Hello, my name is Gonzalo Rosillo, and today I'll be talking about Spain's response to the first and second COVID-19 waves, and more specifically about the impact on residential care homes. So if we look at the Global Health Index score, which was published last year, Spain's sanitary system seemed to be prepared with an overall score of 66 and a position in the ranking in the number 15 out of 195 countries, especially with a very big capacity to detect the emergence of new epidemics such as COVID-19. Moreover, if we compare these results to other neighboring countries, we see that the Spain's sanitary system was not less prepared. In fact, in some cases was more prepared than other countries, which later on were less affected by the first wave of COVID-19. So currently there are 45,000 deaths related to COVID-19, according to different estimations, although these vary. The main problem was that there was a lack of coordination between national and regional governments and a political polarization that has hindered the effectiveness of the response to the pandemic. However, we are now seeing stabilizing figures of both new confirmed cases and deaths during the second wave. But still, there is a need for policy reform to improve the coordination among administrations to prevent and control the outbreaks, especially in residential care homes, which remain a very important point of vulnerability. So this is the situation now. As we see, the figures are stabilizing during this second wave, which Spain is going through. And overall in Spain, in most regions, there are less than 400 new cases for each 100,000 citizens, which is good. So when it comes to Spain's response to the first wave, well, the first COVID-19 case in Spain was registered on 31st of January, and the first death the 13th of February. The government was severely criticized by its alleged negligence during the previous weeks previous to the implementation of the state of alarm and the lockdown on the 14th of March, especially for the 8th of March incident. So the executive did not prevent hundreds of thousands of citizens from taking part in nationwide marches for International Women's Day, but a week after, it was forced to impose a lockdown. Moreover, Spain is as you may know, is a semi-federal system in which the sanitary competences are decentralized. So when the state of alarm was declared and the Minister of Health became the leading authority, it failed to centralize all the operations related to the acquisition of health personal protective equipment for health workers, because it lacked the capabilities to do so. It didn't have the experience. So at the end of the day, the autonomous communities were the ones who had to go to the market and acquire this protective equipment. So the result was 50,000 infected health workers, very far from figures such as France's with just 30,000 or Germany with just 15,000. On 9th of April, Doctors Without Borders issued an alert warning about the critical situation of elderly residents in care homes. So during the first wave, according to different estimations, there was an excessive mortality of 48,000 deceased compared to the average of the last 4 years. And according to the Minister of Health, 71% of deaths related to COVID-19 in Spain were in residential care homes. This figure has currently been updated. So now it seems to be around 51%, but still it is a very high figure. So yeah, this here we have some pictures about the 8th of March, which generated a lot of controversy. So more specifically, in terms of the catastrophe of residential care homes during the first wave, there was a suspected discrimination and arbitrariness in the transfer of seriously ill elderly from nursing homes to hospitals. So there are some accusations, and when some UCIs in some regions were at its full capacity, there seemed to be a discrimination in this case. So some elderly were not transferred to hospitals when they needed to. Moreover, there was a big problem with absenteeism of nurses, which grew, according to the Ministry of Health, 60%, mainly due to the pressure and the poor working conditions, with contracts with a salary which was 40% lower than nurses working in hospitals, for example. There was also a lack of contingency plan in the event of an epidemic at a national level. And according to different organisms, such as the Instituto de Políticas y Bienes Públicos, there is a need for an improvement in the coordination between the health ministry and social services of each autonomous communities, which are the ones in charge of managing this the residential care homes. So both at the institutional level between ministries and regional organizations and regional administration, and at the organizational level between the sanitary and the long-term care systems and social services. So during the first wave, we saw a high degree of securitization with a very active involvement of the Ministry of Health. So this implementation of the Operación Balmis, and especially in the case of residential care homes, so this the army was in charge of disinfecting and preventing new outbreaks in residential care homes, which, as I said, were particular points of vulnerability. So during the second wave, well, on the 21st of June, the state of alarm officially ended. So the de-escalation phases, which were managed or controlled by the central government, officially ended, and we entered what was called by the government the new normality phase. But still, there was a lack of coordination between administrations, and the de-escalation seems to have been too fast, and it was very decentralized during the summer. There was a very big problem in terms of tracking of new outbreaks because it was efficient. So Spain during the summer just had around 3,000 trackers instead of the 11,000 trackers which were needed according to the SESPAS, the Sociedad Española de Salud Pública y Administración Sanitaria. Moreover, there was a failed strategy of social communication. So the government, there was a lot of confusion among citizens because measures varied depending on the autonomous community. So there was no clarity in this sense. And this message or this campaign, Salimos Más Fuertes, presented by the government, also generated some confusion. So the government tried to construct this reality that well, everything was okay, everything was over, but this was not accurate nor an objective reality. So there was a failed strategy of social communication in this sense. On the 9th of October, the government declared the state of alarm in Madrid at the peak of the second wave, and on the 24th of October in the rest of Spain. However, we have seen a stabilization of the figures of new infections and deaths. So this is the example of the campaign, Salimos Más Fuertes. There has been a lot of frictions, especially between the regional government in Madrid and the central government of Pedro Sánchez, because of well, differences in opinions about the measures which were needed to be implemented. So in the case of residential care homes, there has been a reinforcement of protection. The situation overall in residential care homes has improved. There has been a new early response plan for residential care homes. So this was developed by the government to well, control the new protocols and well, validate them to a certain extent. However, we see that, for example, in the case of Catalonia, 50% of new outbreaks are still in residential care homes. So this figure is still too high. And of course, the situation varies depending on the region, but we see in the case of Catalonia, Madrid, Castilla y León, and Castilla-La Mancha, the current situation is still very worrying in the case of residential care homes. So these are very important points of vulnerability, and something must be done to avoid the same from happening again. So that's the policy recommendation. So first of all, as I said, during the first wave, we saw a high degree of securitization of the pandemic. However, now it seems that there has been a sanitization during the second wave. So there is less involvement of the Ministry of Interior and Defense, which seem to have disappeared from press conferences. However, they play a key role in assuring the compliance with preventive measures, such as well, control of mass gatherings, or prevention of illegal parties, which have been a very important source of new infections. There is a need for an improvement in the coordination between national and regional health authorities. Especially, there is a need for a clarification of competences of each level of government in the event of an epidemic such as COVID-19, an improvement in the intersectoral coordination between the social services in charge of the management of residential care homes and the sanitary system. And also, as some organisms have requested, there is a need for a centralized organism, not just an early response plan, with the authority to validate new protocols for residential care homes that may need to be implemented in the future. So maybe new protocols need to be implemented in the future, so there is a need for a centralized organism. Fifth, the creation of a shared information system about the residential care home system between all the levels of government. And it is also very important that residential care homes receive feedback from the data they send to regional governments. So feedback about, okay, so you're doing well, or you need to improve this, or you are above the average. So this is very important information. And lastly, an increase in the public funding to improve working conditions of staff at residential care homes to avoid absenteeism, and also guarantee the provision of the necessary personal protective equipment and PCR tests. So thank you very much.